Hi, this is Dr. Maricondo at My Ontario Dentist, and this is, I guess it's officially now going to be dropping some dental knowledge with Dr. Dave. Boom, explosion. That made Kelsey laugh. So, a question I've gotten today, and honestly a question I've been getting even from my friends and family is, Doc, like what's the difference between SmileDirect and Candid and Invisalign? If I want to do the straight aligners, basically to correct my bite, have a prettier smile, XYZ, because one costs less and one costs more. So I think this is a really important topic. So in fact, I wrote down what I kind of want to say because I want to touch upon all these points. So the first thing is cost. Yes, Candid and SmileDirect cost less. But it's in my heart of hearts, I do believe you're getting much less value from it unless you are a very particular case. So I'm just going to kind of, I know I normally just talk, but this one's important. So I do feel like you do get less value from that service. And one of the things is you're not under a professional's care. You're not seen by a dentist. No one's really held accountable to make sure what they're promising actually happens. So that concerns me as a profession. That concerns me for me as patients. It's fine to shop on Amazon and get directly sent to you, but I'm concerned when it has to do with your health, especially if there's no one held accountable to what's being promised. Here at our practice, ultimately, I'm held accountable to not only the board, but to your care, and to make sure that if we are moving and aligning your teeth, that we achieve the outcome that we discussed. So the next thing is, in that movement, how does that occur? So currently with Candid or SmileDirect, they ship you a box with some Play-Doh and that you mix together to create impression material and 4 trays, so you get 2 attempts to take an impression. At NYU, they were kind of famous for breaking your impressions and breaking your models if they weren't perfect. It took me years and a lot of heartache to get really good at taking impressions. So I think it's a stretch to assume that a patient can look in a mirror, mix 2 materials by hand, and know the exact setting time of that impression material, put it in the tray, that's a stock tray, it's not custom for your mouth, and take a perfect impression in 2 tries. It took me years in dental school to learn the art of taking an impression. And in fact, Invisalign is very particular about what impressions are acceptable. I've had impressions denied from Invisalign because they want perfection. So that's one thing. The other thing is, currently at the office we have a digital scanner. A digital scanner has been shown to be about 7 or 8% more detailed than traditional impressions. So if we use the digital scanner here at the office, I can get a very, very detailed digital impression, more detailed than what you can do at home, and send it to lab. Why is that important? Well, it's super important to have a really, really good impression because they have to make really, really good trays. I know they're plastic, but they're actually pretty marvelous technology. So those plastic trays are what move your teeth in sequence. And if they don't get a perfect impression, how can they move your teeth efficiently in your mouth? So I'm concerned about the quality of the impression or the quality of that in fabricating your trays, because unless it's perfect, then it can't predictably or efficiently move your teeth. So I'll leave that there. Let me see. Another thing, with SmileDirect, they just send you the trays. There's no what we call like power buttons that can be placed. With Invisalign, Some teeth need to be rotated, some teeth need to be pulled down, some teeth need to be pushed up, some teeth need to be give a little extra. And what we use is we use power buttons or composite with the tray to move those teeth efficiently. Currently with SmileDirect, there's no way to do any kind of power buttons, so I'm concerned about the efficiency of the teeth movement. Currently with Invisalign, they've done over, I think, like 1 million cases. So what that means is they also gather the data and how people's teeth move, so that when they track and they create the algorithm, maybe for your case in the future, they have all this data to support how the teeth are moving. Currently with SmileDirect, they have just about 20,000 cases to fine-tune their algorithm. So you're also paying for the algorithm, you're also paying for the data, you're also paying for that with Invisalign to move your teeth more predictably and probably safer, to be honest. Another thing with SmileDirect, there's no adjustment, there's no refinement at the end of your treatment. What you start out as and whatever you finish, that's where you finish. Here with Invisalign and with our practice is we can take your teeth from here to here, and then we often stop at the end of treatment and look in a mirror and want to make sure that you're happy with that final outcome. Oftentimes, just like at an orthodontist, there's a refinement or a refinement period, and that just means we fine tune to get you the exact alignment and smile that you want. And that's at no additional charge. So you do get more control, and it keeps it more predictable than just say, hey, take some impressions and here's your trays and you start here and finish here. I would really hope that they would want to make sure that you actually finish where you finish and that you're actually happy with that alignment that they promised you. And the last thing is, with Invisalign, we take X-rays, we take a lot of other diagnostics so that when I work with the lab technician, they make sure that the teeth and root move in your bone efficiently. Currently with SmileDirect, it's just an impression. They have no idea they have no information from X-rays, and they have less photos, so they have less information to go on. If they're moving teeth through your bone, I hope that they would have X-rays of your roots and your bones, because that would probably help determine how those teeth are moving and how they should be moved. Not every root in your bone is straight. I call them salsa teeth. Sometimes roots are curved, sometimes a lot of different things. So how can they move the teeth efficiently or know how to move the teeth efficiently without knowing the root structure or how much bone? That makes me concerned long term. To be candid, no pun intended, I see a lot of Instagram famous people and advertisements for it. But I'm just concerned, what's the outcome? Like, is anybody tracking the outcomes? They might have all these patients, but are all these patients happy? And are all these patients happy with their smile? And is their bite correct? Let me just make sure I didn't miss anything. I know this one's going long. I apologize. Kelsey's already tired. So I guess just to sum it up, the only cases that I would really feel comfortable recommending to a friend or family member that's good for SmileDirect is if you have mild crowding of your 6 bottom teeth and 6 top teeth. Anything more than that, I really have a hard time believing that they would be able to achieve what they say they achieve. So if you are considering doing that, just make sure it's really just mild crowding or mild spacing of your lower front 6 or your top front 6, nothing more than that. So I hope this was informative. Ultimately, I want my patients to make the best decisions for themselves. I'm here as a guide and as a resource, and that's how I see myself. But overall, in my heart of hearts, I do believe that yes, one costs more than the other, but you're getting much less value than you think you are getting if you really want to do it right. So I guess that was a serious one today, but if you have any questions, please don't hesitate to ask the office or ask me in the comments below. And I hope you have a good day. See you.